Munga, who was with us from the Ministry of Air Health. And one thing that he touched was that Africa needs to find solutions for some of the pressing challenges within the African continent. You know, and the last 2 days we've had amazing pitches from different startups within the health tech ecosystem, and some of them are here with us today. So if it's okay, if you can all allow me, I'd like to invite some of these startups to just share with us the key takeaways from the last 2 days, as well as the innovations and the solutions that they're coming up with. So I think, Alois, if I could call you first, if you can come and share with us. Just do tell us about your innovation and tell us what were your key takeaways for day 1 and day 2 of the Health Tech Africa Summit.
Thank you. Good morning or good afternoon. My name is Alois. I'm the founder of HelloMed. HelloMed is a digital consulting platform created here in Rwanda. I'm Rwandan. So the 2 days focused on developing platforms or solutions that are tailored for local market. And also focused largely also on partnerships because some of these solutions, we develop them, but we need the public to use them. But the process of authorization, that process really takes, so long, and they end up, solution just die a natural death without being used. So on the side of government, other partners, and the side of startups, for major challenges on the startup side was really about legal framework, legal structures. You have a concept, but it takes a long time for you to get authorized to operate. And that takes a toll on us who are creating those solutions because we create them to be used, but also it doesn't really benefit the entire community. So I think the key point we should all agree on is that there's need for embracing those solutions. And we also talked about adaptability and sustainability. So adaptability goes with, like we're saying, authorization. So if I have a concept, but I can't test it on the market, then the users, they are not aware. So this really ends up, being a waste of time and a waste of resources and a waste of energy and all those sorts of things. So in short, we should agree from here that partnerships are way to go, especially government, startups, partnerships. Government should allow concepts to be tested, because some people gave an example of fintech. I think they were saying this issue we are having in healthcare is the same issue fintech had 10 years, 15 years ago. So there should be a platform where we creators and the users and the regulators have a platform where we create stuff that can be actually tested on the market. So in short, I would encourage people, participants, to think that way. And on the startup side, we've made some very good networking that is really going to move our solutions further. And thanks to Novartis for giving us this platform, executing what we actually think can work. And thanks everybody. So we are calling all of you to join us, see what we can share, and then let's take these solutions and help take solutions way forward. So thank you so much.
Thank you so much. He's called Alois Rukondo. He is the founder of HelloMed. Is there anyone in the audience who would also like to share some key takeaways? Okay. If you could kindly come to the front.
Hello, everyone. I'm Innocencia, CEO and founder at Clara. I'm from Cameroon, and my venture is based in Cameroon, but looking forward to expand. For the past days, it has been very interesting and exciting. I've gotten to learn so many things. On day 1, we had different panel discussions, among which was looking at global problems and local solutions. And some of the challenges included issues like funding, and we were also taking home the message that funding is not all about money, it's about access, it's about network, it's about know-how, and I think the Novartis Foundation is giving us that. Because when you put it all together, then you can be able to get smart funding, and it will help the startups to go very far. Yesterday also we had an opportunity to hear from other startups and also get the ventures of other people. And it was, so far it has been a beautiful ride. We have been able to network with a couple of persons. We have been able to know what people are doing and then just get the feeling that your challenges is not new to you. There are other people who share in your challenges, and Novartis Foundation is giving us a platform to be able to go through that and use technology to solve our problems, because we are just thinking that technology is going to do to healthcare what the mobile telephone did to communication. So it is a ride and we are on. Thank you very much.
Thank you so much, Innocentia. In the audience, we do not only have startups, we also have different people who participated in both day 1 and day 2. If there is anyone who'd like to come and share with us some key takeaways, kindly just raise your hand, or I can come and give you the microphone wherever you are.
Thank you. My name is Joris Chizere, and I'm the strategy lead at the Center for the Fourth Industrial Revolution. I think perhaps the one thing that stuck with me the most is in the first panel that we had, there was a comment that the Minister of Health mentioned around going from looking at patients as patients to looking at them as clients, which means how do we go from just thinking about health as a cost center to innovation, rather to a sector with a lot of potential for innovation, and how do we be very, very keen about bringing technology and medicine, or in medicine together. So a lot of the startups here, of course, are technicians, technical people, engineers, and all that. So how do we bring in the doctors as well to get that knowledge and essentially look at the patients as clients and create winning business models around that for in order to ensure sustainability. So I think that's probably the one thing that stuck with me the most.
Thank you so much, and I think we'll be getting into today's program, but I'd like to hear from a few to just get some last few words. Okay, we have two hands here. I'll start with you.
Yes, so one of the most interesting key takeaways, one from the panel on about startups, was the power that there is in entrepreneurial energy as a part of the solution, I would say, for more effective, efficient, and powerful ecosystem, healthcare ecosystem. But also, and that wasn't on my panel, the necessity to have more medical professional and committees part of these initiatives, part of the construction phase, I would say, to make sure to bridge the gap between the research, the real issues on the ground, and on the other end, the commercial / entrepreneurial solutions. So looking forward to see more of that happen. Yes.
Thank you very much, Augustine Chizo from the AE Trade Group. And the one takeaway that I had from yesterday's panel, which was very important on the data and data privacy and the policy, is that we have to create a platform which is not 1 year or 2 years repetitive, but every day we need to link the policymakers with the beneficiaries, with the political will, because sometimes we saw that there is a political will, but the technicians and those policy enforcers and the beneficiaries, we the startup people, we need to have a platform where we meet and we discuss those policies. And sometimes we may find that those policy enforcers, maybe they are not having the same will as those policy makers and the political will which is in place. So I think all these links have to be in place so that the technology in health and other parts of the ecosystem may move forward. Thank you.
Thank you so much. I'm going to pass the mic to the last person, and then we'll get into today's program.
Thank you. My name is Thomas, and I'm also the founder of Digital Realm and Neutronic Systems, and we are also providing solutions and ecosystem enabling solutions for startups to scale their solutions. And one of the things that stuck with me the most during the last 2 days is about the way tech is heavily involved in healthcare, and recently you cannot run a business without using technology, and technology evolves every day. And as tech solution providers, sometimes you always have to be waiting onto the regulations to catch up with the evolution of technology, which means governments and regulation makers are always playing catch up with the evolution of technology, which sometimes hinders innovation, and also looking forward to the way we're going to have to find ways to enable and enforce startups to find better ways to work with governments so that they don't have to slow down their progress, so that the laws can catch up, because sometimes the patient who's on a waiting list for 5 months, they don't have more 2 years to live if they don't have that solution, which is innovative and available at the moment. Thank you.
Thank you. Lucy, you want to add something? Oh.
Just maybe as a last remark from my side, I think we're the living proof of what collaboration can be achieving. It's about co-creation. So that's my key takeaway word for the last 2 days, and actually for the past week, because what we have started in Rwanda, being a Pan-African venture of co-creation, is just the beginning. So the example is the work that we have been doing with the Ministry of Innovation and ICT, the work with the Ministry of Health, the Rwanda Biomedical Center, the Center for the Industrial Revolution, our partners from University of Basel. It's co-creation across the board. It's not just for one city, it's not just for one country, it's really Pan-African innovation, and we make it also possible with our partners from Norsken. And the reason for that being is that we strongly believe that innovations have the power to transform health systems from being reactive to proactive, predictive even, and one day hopefully preventative. And we want to find the most innovative business models who can thrive in public health systems by thinking not only of the classic business models of business to consumer or business to business, but also of business to government. So we think together of not only how we can provide the smart solutions, but also how we can jointly pay for them. And so with that, I'd love to hand back to Fiona for an exciting day of a launch of a very important report, which is changing the future of virtual health and care.
Thank you so much, Lucy, for those remarks. And yes, we are now going to get direct into the launch for today. I'd like to ask if the technical team can go ahead and actually play the presentation by Dr. Soumya Swaminathan, the Chief Scientist at the World Health Organization, for his remarks on today's launch.
Greetings, Excellencies, ladies and gentlemen. I'm Dr. Soumya Swaminathan. I'm the Chief Scientist of the World Health Organization. And I'd just like to say a few words today to firstly thank you all for being here for the launch of this report of the working group of the Broadband Commission, and to thank everyone who's been involved, particularly the co-chair and from the Novartis Foundation. The COVID-19 pandemic saw an exponential rate of growth in the provision of virtual health and care services. Of course, all of us have been working virtually, but particularly in the health field and telehealth and telemedicine, we saw this used much more across the globe. Both patients and providers say that they would like to continue benefiting from it because it does offer a lot of conveniences and it does help us to bridge some of the barriers to access to care. And we believe that it's here to stay and is part of a new hybrid model of health systems combining in-person with virtual health services. All stakeholders have a role to play in ensuring that virtual health and care is adopted in an inclusive and equitable way, because what we do not want is that this system again disadvantages the same people who did not have access to regular health services. We don't want them to be excluded because they don't have access to virtual or digital services. So this needs to be looked at very carefully in each country, and the public sector and the private sector and other regulatory agencies all have an important role to play in making sure that the access aspects are particularly well looked at. So this new report builds upon the WHO's global strategy on digital health, which was adopted in 2020 by our member states, and it encourages countries to be forward-thinking and proactive in defining comprehensive national frameworks for virtual health and care policies. One next step that we think is essential is further documenting the evidence around health outcomes so that the decision makers or the policy makers can support those solutions that have the largest impact on population or individual health as they continue to digitize their health systems. So the role of research and evidence as part of the use of these new digital tools and technologies is extremely important, and I would like to re-emphasize that. The findings of this report, which did some in-depth deep dives into some countries, supports our current engagements with member states and will be an essential part of the recommendations that we are producing through our working group on telehealth and telemedicine. So we will very soon come up with technical guidance to countries on the provision of telehealth services. So I want to thank all of those who were involved in the production of this report, including my own team from our Digital Health and Innovation Department, so Derek Monini and his colleagues, but of course also the other working group members and the consultants who supported this work. We look forward to continuing this discussion with our partners and particularly with member states, and to leverage the maturity framework in this report to help countries define their own roadmaps to scale virtual health and care that drives health access and equity. Thank you very much.
Round of applause. Thank you so much, Dr. Sumia. She is the Chief Scientist at the World Health Organization. And now we are delighted to have with us Dr. Anne Ertz. She is the head of Novartis Foundation. I'd like to invite her to come and share her remarks with us today.
Thank you so much for the introduction, Fiona. And let me also start by a very warm welcome to all of you. Thank you for coming. And you heard about the Health Tech Hub Africa now from all the exciting entrepreneurs that are hosted here and from my colleague Lucy. But I also want to send a special thanks to our guest, or our host even, sorry, who is our partner of the Norscon Foundation. And Pascal is a managing director of the Norscon East Africa House here, and thanks again for this fantastic partnership. I would invite all of you to take a look around when you have a chance after the event, or even whenever you are in Kigali, because it's really nice to see this environment. So welcome. And I have the immense honor to present you a little bit of a preview or the main insights of our report on the future of virtual health and care. If I could have the slides, thank you. So we started by asking ourselves, what is virtual health and care? Because there was a lot of confusion about the terminology, and many people using telemedicine, telehealth, digital health, electronic health, all of these different terms, and no one knew what exactly was virtual health and care. So the simple definition we agreed upon with our co-chairs of the World Health Organization and all of our Broadband Commission working group members was that it is the remote delivery of health and care services using digital means or digital technology. Why is that so important, virtual health and care? In fact, you heard it from Dr. Sumia, but what we found out in our interviews and in all our analysis during the research was that a vast majority of people wanted to stay We've seen during COVID a really unprecedented expansion of virtual services throughout everything in our life, including health. And in healthcare, people, as well patients as providers, really wanted to stay. In the beginning, there was a lot of skepticism. I remember colleagues in the UK, in the NHS, were saying they really didn't believe in virtual service delivery for health, but when they saw the benefit of that it was far outweighing the risk, they were rapidly taken over the line. So it is here to stay. And why is that so important? It really matters because we are convinced through all these fantastic examples we saw, and this is only a handful of them, that it can really decrease these existing divides, including the digital divides, in certain population groups. So it can decrease the inequities that exist for older population. There's fantastic solutions that help older population use virtual services. The divide between different income groups or different people with disabilities, there's fantastic solutions for that as well. So it can decrease these existing divides, and we have to build on that momentum to make sure it stays in that way, that virtual health and care improves health access in an equitable and inclusive way, just like Dr. Soumya said very nicely. So we started the whole research with a landscape review, and we did 23 deep dive country studies. And they are all documented in large and detail in the report, so I would invite you to discover that in the report. I will just give you some examples of it. And we wanted to understand why did some countries really rapidly scale virtual services in the beginning of the pandemic, and some countries were left behind. It wasn't a question between difference of high or lower income countries. It was a difference in the agility of the governments to adapt their legislation and regulatory frameworks to make virtual services available and avoid a disruption of critical health services, if you may, because it became a question of life and death in many places to have access. So we saw, for example, in the US a very rapid increase in the use of virtual consultations, and it was all driven by the fact that the government decided from the beginning, we waive these licensing limitations. So in the US, you can also only provide care to a person who lives in your state if you are a health provider. That was immediately waived away. So patients could access expertise, specialists in other states through virtual consultations thanks to that policy relaxation. But also the reimbursement of virtual services was immediately nationwide implemented, and that makes a lot of difference. You can see, in fact, the baseline that we see now, that we saw before COVID, is far lower than the threshold where we now are. So in fact, it remains high. Even if it went down a little bit after the height of the pandemic, the use of virtual health and care, the level it is now is much higher than before the pandemic. We've seen big retail stores like Amazon and Walmart delivering virtual health services, and that is there to stay as well. The market is going to grow massively. Another example, in India, on the other hand, we saw that the uptake was driven mainly by incentivizing digital innovations. So we saw, for example, the COVID tracker in India was the largest downloaded tracker in the world with, I don't know how many, 200 million users downloading this in a few months, in fact. So very nice examples. The telehealth provider, the biggest telehealth provider in India, Apollo, was the first to receive this ISO certification, making it qualified as good as in-person care. So these evolutions were really crucial to guide us and scale the virtual health and care uptake. The third example I want to highlight is the country where we are here today, in Rwanda. In fact, Rwanda took the approach also nationwide, I believe, Minister Paula, to really make sure that people have access to integrated digital care through this fantastic partnership you have with Babylon Health here in Rwanda. So people can access virtual care because it is also included in the community health insurance. So they get the reimbursement for such services, making health and care services available to many more people. As in Rwanda, many people live quite in remote areas. This is crucial for increasing access in an equitable way. So very nice example as well of how the uptake was really rapid here in Rwanda. We then use these 23 case studies, country case studies, to distill the real policy elements that mattered. Which were the policies that enabled a rapid uptake, and which were the policies that were kind of barriers to uptake virtual health and care? We saw countries like Japan, South Korea were really behind in the uptake of virtual health and care, as the regulatory frameworks were very stringent. And we wanted to understand what exactly in these frameworks was it. So we distilled 15 policy elements, but they range from liability and provider licensing to data governance and privacy, all of these different elements, but we made them even simpler for policymakers to understand in the 6 policy pillars based on our AI in health maturity roadmap that was developed by the previous working group of the Broadband Commission on health a year ago. So the AI in health maturity roadmap is built on 6 policy pillars, and these same pillars are now the maturity roadmap towards virtual health and care. So it is all about governance and regulatory systems, making sure governments create integrated health plans using both in-person and virtual services. That making sure that governance they decide on these liability and licensing questions if that's an issue. If you don't have enough specialists in your country, what about having expertise centralized in another country and having your patients get access to those specialists? It is a very nice example of how it can also address the shortage of skilled health workers. In the field of data and technology, obviously, I don't have to tell you, it's you heard it also from the startups, it's a lot about making sure your solutions are interoperable, that there's a clear standard for privacy and security. But key to it all is that the people in the country, and specifically the health and care workers, have the digital skills necessary to use all these services or to provide the services. And that's everywhere in the world. In the UK, they train specifically doctors in the beginning of the pandemic, and specifically the older doctors who are not so digital savvy on the use of virtual services. So it is worldwide a need that population's digital savviness gets upskilled. And there's a lot of agencies and players who are working on that. So that is very promising. The design and processes is similar to our AI in health maturity roadmap. But what is key, that it's human-centered. We have seen that during COVID, if you have to have access to care, it has to address your need in your specific place. So the idea is that the virtual health and care can deliver the right solution to the right person in the place where that person needs it. So that is really key, that it's human-centered but also needs-driven. It's not a good idea as an entrepreneur with a smart innovation to come to a certain country, please use it. No, you have to talk to the decision makers in the country, understand their priorities, and then develop your solutions according to those needs. That is absolutely visible, very strong driving force. And there's many more examples I mentioned in the business models. The financing, the reimbursement is key. And I think many African countries are still struggling with that. Covering a total nation in community health insurance is an incredible achievement in the African setting. So I think that is really something to showcase and to replicate as much as possible, including the virtual services, of course. So all of these recommendations or the whole roadmap, if I may, the policy pillars are then translated into recommendations for decision makers. And I gave you a lot of examples. I'm not going to go through them in detail because I want us to have more time for the discussion. But I invite you to discover them in the report. But what I wanted to say is that's not only the task of the decision maker in the country. I wanted to make the point on the demand side. You raised, Carlos, in the meeting the other day. So it's really that we need to sensitize people to use the services. We need to create the demand, that they trust it, that they find that a virtual service is as reliable as the in-person service. That is really essential. And there we need the whole society to help us. So advocacy groups, but also civil society groups, help people understand the benefits of using virtual health and care. It is the future we go to have hybrid health systems. In the post-COVID world, if we can already call our world like that, I hope we do. But we will never go back to the world we had before. So we have to live in a world where we create hybrid health systems. Every health system has to transform to that, to integrate the virtual services in combination with in-person service. That's the only way countries can transform their reactive care systems, only looking at clinical care for patients when they get sick, when it's too late, to become proactive health and care systems that also can become predictive with more and more use of data. Obviously, that's really important. And that can ultimately become preventive to keep their populations healthy as long as possible. So that is the goal of this report, a call to action for all decision makers, both the policy makers, the providers, the payers, the civil society. Everybody has a role to play in the scaling up of virtual health and care globally. So let me end by thanking everyone who contributed to this report, and a very heartfelt gratitude goes on to all our Broadband Commission members, and several of you are here, so thank you again for your generous contributions to these reports, because the case studies and the depth of the information that comes out of this report is thanks to all of your inputs and from your teams. So I wanted to thank you. We also had an external expert group contributing. You see all the organizations here on the slides, and everybody, again, very, very active, very engaged to make this report a success. And the last special thanks I want to send, just like Dr. Soumya did, first and foremost to the WHO co-chair. Soumya was absolutely fantastic to work with, and her team with Derek Munene and Salim Azabi. Also the Accenture team, who was instrumental, and a very warm thank you to Natasha Sunderji, who led this team of with Manu, Rajini, and Akash. They were instrumental in developing the landscape analysis and the roadmap out of these insights. They also wrote the whole report, so the whole applause is for that entire team. From the Novartis Foundation, I want to thank Jason Shalaby, who could not be with us today, but Lucy Setyan, who's here, and Caroline Canham as well, our communications lead. Thank you for all the hard work that went in here. And Florence Gaudry-Perkins from Digital Health Partnerships, plus all these other experts you see on the list. And lastly, I didn't see you, Anna, but if you are listening to this, thank you so much for all your support. The Broadband Commission Secretariat, as always, is fantastic when you have to organize these things. So thank you, Anna, and your team again. So maybe we can put the panel. Thank you so much.
Thank you so much, Dr. Anne, for taking us through the presentation. Now we're going to dive right into the panel, and we are going to have an understanding on the discovery as well as application of the best practices from the Virtual Health and Care Maturity Framework. I'd like to ask all of you to help me welcome our panelists, as I call them one by one, to take their seats on the stage. I'll first start with Honorable Minister Paula Ingabire. She is Rwanda's Minister of ICT and Innovation. We are delighted to have you here with us. Kindly make your way. Up next, we also have Dr. Brian Chirombo. He is the representative of the World Health Organization to the Republic of Rwanda. You're welcome, sir. I'd also like to call to stage Dr. Anne. You will not be running away from us. We also need your insights on this panel discussion. She is the head of Novartis Foundation. I'd also like to call to the stage Mr. Boker Ba, CEO of Samena Telecommunications Council. Last but not least, we have Mr. Lassina Kone, the CEO of Smart Africa Secretariat. You're welcome. Double checking if we all have our mics, I can see. Okay, so now to get insights, Dr. Anne, you've just shared with us a remarkable presentation, but I'll still start with you because I want to understand what are the most important learnings from this report, because that will set pace for this particular panel discussion, and also give us a visual idea. How does a hybrid health and care system really look like?
Thank you, Fiona. Well, the most important insights, I summarize them now, but I think for me, the most important insight is it really made us advance in such a short time in the field of the digitization of our health and care systems to become these hybrid health systems. People wanted to stay, and that's really important for all decision makers around the world. Once you introduce these virtual health and care services, people and patients and providers all wanted to continue. They feel this is the right way to go. And we do it for every aspect of our life. I don't think anyone here is still carrying cash with them. You all pay with mobile money, so why wouldn't we have remote health and care services as part of our normal lives? So that definitely is what I feel should become our health systems of the future if they are not yet there. And that's the hybrid format, yes.
Definitely rethinking the relationship between health as well as technology. Dr. Chirombo, I'll come to you next. Can you tell us why the virtual health and care maturity roadmap is an important stepping stone to the World Health Organization global strategy on digital health?
Thank you very much, moderator, Honorable Minister, distinguished guest colleagues. It really is a pleasure for me to participate in this very important panel, and good afternoon. The report is really, really critical because I think Anne has given a very good background, particularly when she presented the report itself. But this is a critical time, given the environment where we live, particularly we're not really, we hope we are into post-COVID, but I think it's still it's likely to still be a process. But I think this is a time, COVID, I think, as Anne described, digital health became so critical. Actually, we couldn't survive without it. But even as we move from COVID, digital health is still very critical. What COVID did was to make us realize the criticalness of digitization and the need to invest in digital health for us to strengthen the health systems. Obviously, the pandemic created quite some challenges in the health system, and I think Anne and Sumia talked a bit about them. But it also created these opportunities. And for WHO, digital health is critical. WHO has already been working in this area for a number of years, and that's how the strategy came to be. And I can quote my Director General, Dr. Tedros. So this is one of his comments to our executive board, and this was a few years ago. The future of health is digital. It is a must that we embrace it. So this was even before COVID hit us. WHO needs to be ahead of the curve to harness the power of digital technologies for global health. So there was already a bit of discussion about it. Now, virtual health and care is a facilitator for building resilient and sustainable health systems. So, as we may be aware, I think you already mentioned now the WHO Global Strategy on Digital Health, which was launched in 2020, aims to ensure global collaboration, aims to advance digital transformation at the global, regional, and country level. It's got, and when I highlight the main objectives and goals, you will see that it really dovetails into this work on virtual health and care. So the first objective of that strategy is promoting global collaboration and advancing transfer of technology. And this includes fostering partnerships and international collaboration in digital health and using the strategy, using the lens of the strategy. Advancing implementation of national digital strategies, and Anne talked about that, which need to be owned by countries, which need to be looking at the country needs, and the implementation of that is really critical to the strategy. Strengthening governance, and I think again we had Anne talking and giving us in the elements, the aspects which relate to governance in digital health, and global, regional, and national levels. And then finally, she talked about the people-centered health systems. So when you look at the goals and the objectives and what's described in the global strategy, it's very closely linked to the findings and the recommendations that come out of the virtual health and care maturity roadmap. And just to then highlight that, particularly, I'll just pick up some points of how they dovetail. So, Anne talked about the comprehensive analysis that was done, the deep dives that were done in countries, the looking backwards and then looking forwards in terms of virtual health and care, and the concrete actionable recommendations that were developed. This, we believe, is actually an operationalization, part of the operationalization of the global strategy that has already been developed. So for us, it's very clear that this work is actually a stepping stone to the global strategy that was already in place. Thank you.
Okay, thank you so much, Dr. Chirombo, for your remarks. You've also touched on challenges. I'll come back to you on that one. I'd like to bring Minister Paula into this. We've had importance for countries to really deep dive. So in regard to Rwanda in particular, what are the key policy pillars that you see have the highest potential for impact?
Thanks, Fiona. And I think looking at the 6 pillars that Anne did present, especially in this report, I think one can comfortably say it's difficult to decide which one ranks highest, because I think you can't have one without the other. So it's almost like the building blocks for really having an enabling environment for most of these health tech solutions. But if you were to take a step in terms of prioritizing what is quite urgent, I would even pick up from what Alois shared, which is really also around the need for agile regulations. Joris earlier in his interventions also mentioned what as the government of Rwanda we're doing, even in partnership with the Health Tech Hub here, the Ministry of Health, the Ministry of ICT, to sort of identify what could be those bottlenecks from a policy and regulatory perspective for health tech startups to really be able to test their solutions on the market. And our step, what we try to do is to, one, figure out what are the already existing processes in place, who are the stakeholders involved, who does what, where do you start? Because I think the challenges that most startups are most likely going to face is which institution do I go to first, because they may engage 2 or 3 institutions and realize there's another 3rd or 4th institution that still needs to be on board, still needs to give some form of approval certification before they can test on the market. So I think without such a streamlined process, then it becomes a barrier to how quickly most of these health tech startups can evolve. or two trying to figure out how to comply with regulations and policies, most likely the technology has become obsolete by the time they really need to launch. And so that's the proactive approach we're taking from a policy and regulatory perspective, to say we may not understand everything that it takes, especially because globally the rate of innovation is much, much, much faster than the rate at which we can put in place policies and regulations. Because the idea of policies and regulations, you're always looking at safety as a priority, but at the same time, you're also inhibiting the rate at which innovation can happen. Zipline was a great example for us, because when they started in Rwanda, we didn't have any regulations, but we decided to say, can we do this in parallel? Can we figure out what are the risks, work on them, but also allowing for the solution to be able to be tested on the market? The second one I would look at is around technology and data, because when you talk about health tech solutions, a lot of them are using data, and a lot of them are using personal data. And we all know the challenges around and the risks if personal data is misused. We recently launched our data protection and privacy law, which is already a step in the process, in really giving comfort to citizens, giving comfort to users, that when they give you access to their personal data, it's going to be used in a meaningful way that will translate into solutions that actually help them. But they also will have the comfort that that data, should it not be used for what they have signed up for, because really it's consent-based, then there will be consequences to that. And so that allows for the openness for you as a user to be able to give your data. And the final one for me is business models, because at the end of the day, you build solutions, you want them to be able to be successful. You want a larger market size, a larger consumer base that can benefit from the solutions you're providing. The lady from Cameroon, I think it was an Innocentia, mentioned she's looking for scale. But how do you achieve scale if the sets of regulations you're dealing with in Cameroon are going to be different from the ones you have to deal with in Rwanda, and when you go to Kenya, you have a whole new set of regulations to work with? And I think this is where it's important in terms of, even what the Health Tech Hub is going to be able to support, is that harmonization across the board. Because for our startups, if they have to go through different pieces of legislation, then scale is never going to happen. And if scale is not going to happen, then we're not going to be able to see wide-scale impact.
Definitely. You've actually brought up one of the key components that was being discussed here at the Health Tech Africa Summit, which was navigating data sharing as well as looking at the regional laws. We'll get into that also later on. So, Mr. Boka, I'd like to bring you into this conversation. We've had importance of collaboration. We've heard from the public sector. We've also heard from development agencies. So what role does the private sector really have in the integration as well as moving this up in front?
Thank you very much for your question. Good afternoon, ladies and gentlemen, colleagues. First of all, before answering your question, I would like to congratulate the Broadband Commission, Dr. Anne Hertz, WHO, for this brilliant report that is being launched today. I would say very friendly, everything is in it. Now, we need to take some time to read this report. I will elaborate and coming back onto your question. And this report is coming at a very timely moment. Now, the role of the private sector. We've heard many of our colleagues, entrepreneur, Minister Paula, talking about business model, and I would summarize it in unlocking access to capital, because that's the key of the battle. It's known that the private sector is the key engine for digital enablement and innovation. But at the same time, private sector is driven by profitability. As such, private sector has to make money, even though the use of these applications are for the social benefits of the population. Government is in its role to take care of the citizen, but private sector has to be in its role to make money, and the use of that money could be for reinvestment into the sector. Now, how do we unlock access to capital? We need to collaborate, we need to discuss, we need to redefine, in the wake of this pandemic and the next one, what is going to be the role of each and every one. Therefore, there is a need for alignment. So first of all, we have to identify in this sector the players, the stakeholders. So we are talking about the people involved in the health sector, but at the same time, we will see arising a new generation of stakeholders. We've seen the tech companies. I was listening very carefully to an intervention made by one of the CEOs saying that we have our innovation, but to be able to get to our objective, it's a long way. Therefore, we need to ease access for the entrepreneur to the capital. We want them to focus on developing their innovation. Other generation of stakeholders are going to help them transform it into a realization. But very quickly, when we talk about alignment, it's very important. I try to summarize a few elements. Number one is building an understanding. We need to start having our ministers communicating together. Our Minister of ICT explaining to our Minister of Health the underlying layer. I explain very quickly. If we don't want to exclude a number of people, we have to emphasize on the soft factor, meaning digital skills, access, affordability to the devices, making sure that in the remote area everyone is connected so we don't leave anyone behind. Those who are in the remote area, in the villages, if they don't have connectivity, they cannot use digital health. So, and we have today 46% of the world population not connected. That's the role of the private sector. Now we come into the meaningful connectivity using the health industry. So we have to discuss, define the collaboration. It's easy to talk about partnership, but is it going to be a permanent partnership? Is it a time-bound partnership? So this also has to be defined by the private sector. We need to align the structures, meaning that the organizational structure with all the stakeholders, we need to align and have a proper, I would say, a proper order of action. And Dr. Ann was talking about call for action, but from where do we start? And that was also emphasized by Minister Paula. And of course, private sector need to deliver a strategy. Now that we have discussed, now that we have spread the gospel, now that we have invited all the stakeholders, we need to deliver a strategy that will help us achieve for the government the objective of the government, taking care of the citizen, centering the debate around the population, but for the private sector also to have predictability, sustainability, and profitability. This is to answer your question. Thank you.
Thank you so much for what you have shared. I'd like Mr. Lasine to just piggyback on the comment that you have made, because we know Smart Africa Secretariat, that is one area that they are focusing on, making sure that different African governments can actually be able to communicate and integrate their different policies. So Lasine, the question is to you. How will you apply, looking at the framework that has just been launched today, how will it be applied to the day-to-day works of Smart Africa?
Thank you very much, and congratulations really for the report. It's really a pride for the commissions, broadband commissions, to see this report, to see a day. In the Smart Africa perspective, in fact, you use two words. You use virtual health and you use remote. We don't see it only in the national level. I can be from Rwanda. I found myself in Victoria Falls in Zimbabwe. I'm still remote, but I'm identified here in Rwanda. I have my doctors here. I have my pharmacists here. So what do? So the remote, we take in the context of remote really on the cross-border level, which becomes a challenge. And we've seen this during the COVID. We've seen, I do here my test. I go just to Kenya. The Kenya cannot even interoperate with the Rwandan system or vice versa, or I go to Nigeria. We've seen this. European came out with the a mutual QR code. Well, these are all a sector. I look at this as a sector within the landscape of the digital economy. So this report will be very, very useful as, of course, we are working with the Butner foundations who we have access to some fund from Butner to come out with the continental blueprints on the digital health, which will help every single Smart Africa country member come up with a national strategy on the smart health or health tech, as we call it. it comes together with the toolkits as well as the capacity building is very important, because we tend to forget something. Preparing a future, the future for current generation is one thing, and preparing current generation for the future is a different thing. It's only when you do both of them concurrently, then you're really building a nation, which basically means, yes, to touch base on what Bokar said, touch base with what Minister Polo said, harmonization is very important, digital health is very important, but capacity building is actually much, much important to what it is. But it all comes to one thing. Why we are in this situation? Because we miss the train of what we call TOOP, the only one principle. The only one principle, if you're familiar with what the European Union did, is the fact that if I am born in Rwanda, Rwanda give me ID, Rwanda give me birth certificate, Rwanda give me health card. Why, if I go to a government agency, they still ask me the same information? So if looking at this structured way of thinking, it takes us back to what we call single source of trust when we go cross-border. Very simple. I will take a Rwanda medical card here. I will go to Kenya. Why should I have to respond? I don't have to respond. I only need to swipe card. Whatever I said in Rwanda to my doctor, it will be transferred. That is basically the ultimate goal that we want to reach. But the report is going to be very important in building our continental blueprint for the smart health or health tech. Thank you.
You've touched on an important aspect, which is trust. So how can we go ahead and solve the dilemma between trust and value of virtual services in health and care? Why is data really at the heart of it all?
Thank you very much. And I think there was a startup entrepreneur from Cameroon who also said what mobile technology has done to communication technology do the same thing to the health. The fundamental problem when you go even nationally or cross-border is the trust, is the KYC. One. The second thing also we are struggling with in the health industry, there will be a disruption in health industry. The way the health industry is built today, there has to be a disruption. Because if it's driven by only profit, like we see the insurance companies and all that, at the same time, country need to make sure, every country need to make sure that the citizen and the population have a medical coverage. So it means that they're missing one fundamental boat, which is the data economy. They're not looking at it as a data mining, because we're all running through big data, which is actually fed into the artificial intelligence. Let me give a very simple example, and we'll come back to the trust. For a government, knowing in rural area how many population, group age, category of diseases they may have, number of consultation, it helps the government to predict the future. And that is the big data. That is the one element insurance companies are missing, health sector is missing, and some of the government are also missing. When it comes in terms of trust, what is the difference between what we're doing today from my home? I have my bank in maybe Butare or even Musanze. I usually go, I can take my car, go to the bank, do my KYC physically, do all my transaction. Now I sit on my couch, I do all my transaction in a comfort. What is the difference between that and consulting my doctor at the remote? There's no difference. The only difference that we need to make, the only thing we need to do differently is we need to build it with a privacy by design. Privacy by design, because when you talk about health data, it's about privacy, which might be different, which is completely different from financial. And today, technology is not the limit for the implementation of privacy by design. So that's where the trust comes in. Once it basically, I'm calling into not a public-private partnership, I'm calling on public-private people partnership. That's where the trust will come in between the government and the population. And of course, this is the era of the new social contract that I call digital contract.
Thank you so much, Mr. Lassina. I'd also like to turn to the audience. So we have with us Mr. Carlos Jacques. I'd like to ask you, what are your key takeaways when you're following the launch of the report here today? What would you like to add on to what the panel has just told us?
Thank you very much. You know, at the Broadband Commission, we have established several working groups. And usually they have this fantastic group of experts. They produce tremendous reports, but we feel that the main challenge is dissemination. You know, we've said that the 3 rules of gold for these working groups are dissemination, dissemination, and dissemination. So I'm very happy to see that this report is being launched with dissemination action. If we were to think about the current health system, we could maybe put to us the question of when was it built? Well, it took decades, centuries. And what is the current situation of our health systems? We saw in the pandemic that it was overloaded, the infrastructure, in developed and developing countries. If we look at fiscal finances, we will find that many countries have large deficits due, in a good part, to the cost of public health services. I am from Latin America, and there you can see a lot of inequality in the opportunity for health. You might have mortality rates that are 5 to 1, according to the place where you have the fortune or misfortune to be born. They may be close by. If you look at the doctors per 100,000 people, there's a lot of heterogeneity. So we have a system that currently is unequal. And we can go on and on. And now we are in an era of good technological fortune. This is one of my takeaways. It is an era of good technological fortune, and we can move now into a hybrid health system, which will deal with many of these challenges. But it will not happen spontaneously. We have to do our work, and this report says, well, you have to act on the supply side, and you have to act on the demand side. Now, on the demand side, as Bokar was telling us, 46% of the people in the world are not connected. 46%. So what about e-health, e-commerce, e-education? They have no access to it. The World Health Organization was telling us, well, we have to make sure that this is an inclusive system. Out of the universe of people in the world not connected, 15% is because there's no infrastructure in the places where they live. We can solve it now through satellites and other means. 85%, the majority, is an adoption gap. An adoption gap. Why are they not connected? They have no devices. Well, we can recycle. There are millions of devices every year that are put away. Maybe the content is not relevant for them. There's a lot of content. We saw it in the pandemic. In the health area, there's a lot of content available. So, if there are devices and there's content, why are they not connected? Because they're poor. They're poor. And a mother should not have to decide between buying food to feed her children or buying connectivity. It's not a fair choice. So what do we do? How do we give them connectivity and e-health? There are a series of programs, and with this I will finish, in the world, in all regions, which are called conditional cash transfer programs. You go to the very poor and you say to them, look, I will give you a scholarship, I will give you money provided you keep your children in school. And we will give you additional money provided you go to a health clinic for vaccinations, so on and so forth. And you use that money to have better nutrition for your family. It's called conditional cash transfer for education, health, and nutrition. But nowadays, with this new technological area, which is one of my takeaways, connectivity is also a basic human right. So to these programs that are already in operation, we can give them a connectivity coupon. The government could pay for it. It would be about $10 a month per family. Within the total budget, it's manageable. They're already receiving $30 a month per family. And with connectivity, then they don't have to go to a health clinic necessarily physically. They can do it through e-health. They can have additional education through e-education. So these are the kinds of things that, you know, we can move forward in. It would be conditional, the coupon, upon the family taking courses on the digital world, how to do e-commerce, how to do e-finance, how to do e-education, and most importantly, how to take advantage of digital health. Acceptance. Anne was telling us, and the report stresses, acceptance. We need a cultural change, especially for this segment of the population. We need to show them the virtues. They need to trust the system. We have to work with doctors, of course, but we have to work with the population. So I think for me, the main message would be that. You know, technology makes e-health possible, but it's acceptance that makes it happen. Anyway, that would be my 2 cents. Thank you.
Thank you so much, Carlos, Jacques, for sharing with us your key takeaways from today. I'd like to pose the same question to Dr. Chirombo. How can we give them both connectivity and e-health? Earlier on, you touched that there are pressing challenges that are present today. So what are those challenges? How best can we really navigate and get over those particular challenges?
Yes. So I think the challenges, with regards to the technology side, I think have been touched on. But if we look at the health side, so for example, we can look at Rwanda. In terms of going towards universal health coverage, the country has made a lot of progress in terms of access. But even in Rwanda, which has made a lot of progress, the quality side of things still has gaps that have to be addressed. So there are those challenges in terms of, in other countries, access is still a major issue. So technology can come in and assist particularly the access side, but of course you have to address, the people have to have access to their technology themselves, particularly the people who are having the biggest challenges with health, with access, with the quality, are those who are in the rural areas. They are those who are poor. So we also have to address those sides. But I think technology can be used to, one, address this divide in terms of access. Two, in terms of also beginning to look at the quality side. And I think technology can do that because we're talking about consulting, but I think it's not just teleconsulting in terms of patient to provider, but provider to provider, where we can make sure that the providers themselves, for example, the referral, for example, one of the big challenges is referral to specialized services is a big problem. And you can use telemedicine, telehealth, to have the provider-to-provider consultation using telehealth, which would then address the referral side, but the access, people can then be able to actually access health services through telehealth. But you then still have to address the other side of the demand side of things. So there are still challenges, but what we want is to go towards universal health coverage, and we believe that using telehealth can actually help us to begin to address that divide. Of course, there are other things. There's geographic challenges. There is groups that don't have access. We know that in certain situations, some genders have more challenges. So we still have to address those and think about how we can use technology to address them.
Thank you, Dr. Chirombo, for those remarks. We're talking about connectivity as well as technology. I'd like to bring you on into this, Mr. Boka. We saw during the pandemic, digital divide widened, but also looking at some of the challenges that have been mentioned here in regards to virtual health services, they still do face a lot of challenges. What risks lies ahead if we do not bridge the current gaps that are there?
I think the risks are limitless. I think what COVID and the pandemic made us understand that we have to go toward a massive adoption of connected devices. Now, Professor was mentioning that layer number one is connectivity. We have to ensure that connectivity is there. Now, when we think about connectivity, I would like to refer to technology neutral, because generally we are thinking about 4G, 5G, fiber, but we also have the satellite, as mentioned by Carlos. So connectivity has to be there, but once it's there, it has to be affordable. So you cannot have some people in the remote area in many countries, they are starving. So if you come and talk about connectivity, how they can pay a plan every month, you are completely out of the subject. So it has to be affordable. Who's going to make it affordable? That could be between government, service providers. It's another discussion, but it has to be affordable. One element which is very important is the digital literacy. And this is where I call upon our innovators. There is a lot to be done between virtual reality, artificial intelligence. We have a number of people of our families, the elder generation, they don't know how to read, they don't know how to write, they don't know how to use the digital devices. However, they still need it for their own health and for e-commerce and others. So we have to ensure that the applications are meaningful. There should be a reason for that person, let's say between brackets, to become addicted to the connected devices, whether for health, whether for any other application. So digital literacy is extremely important. And I believe that one thing that government can do is, usually we think about government can do everything and can finance. No, I'm referring to government should be able to champion this approach by coaching the private sector, coaching the other stakeholders, and calling upon a new generation of stakeholders. Lasina mentioned that, the insurance company. So, but bottom line, there is a finance issue. Someone has to pay for it because there is a cost. Now we can discuss who's going to pay for it. The burden should not be carried by the citizen. What we are looking for is the mass adoption of connected devices for, in our case today, solving the health problem. Tomorrow we may sit down with another working group for another application layer. But just to sum up very quickly and make it very simple, the connectivity has to be there. We have to make sure that if the connectivity is there, if you have a Ferrari, you should be able to drive your car. So if you have a connected device, you should be able to use it. And to ensure that our generation of innovators are going to produce meaningful connectivity so it becomes a part of our life. So we have a lot of work to do, but again, we need to organize the sequences of action. Thank you.
We have a lot of work to do. We need to organize a sequence of actions. Minister Paul, I'd like to bring you into this conversation. We are talking virtual reality, we are talking artificial intelligence, and now we're talking having a hybrid health and care system. Where is Rwanda currently? What gaps are there? What lessons can the rest of different African countries learn from?
Thanks, Fiona. And maybe before I answer that, I wanted to make a very quick reflection on some of the interventions that have been made. When you look at the global spending on healthcare, 3% is only spent on prevention. 3%. So imagine the other 97% is more on solutions that are dealing with care when there's already a problem. And I think as we think about virtual and remote healthcare, I think we need to pivot away from only looking at what happens when someone is already sick, but how do we prevent that? It's the behaviors, and I think once you do prevention, the key problem we're talking about, which is affordability and cost, ceases to be a big problem because people are now taking more care of themselves and really trying to put in more effort in prevention than until it's too late. And I think as we launched the report, and very grateful for the work that both Novartis and the World Health Organization have put in, I think what it helps us, especially as the Broadband Commission, is that the Broadband Commission is an advocacy group that is advocating for partnerships across the board. So you don't have the private sector looking at how to solve the problem in silo, from what the role of the government is going to be, from what the role of startups and entrepreneurs and researchers is going to be. And so this report is a perfect example of what is it going to take for the multiple stakeholders to work together to solve this problem. But I think we need to put a lot of emphasis even on prevention, because without that, then we're solving just part of the problem, but not fully. And I think Professor did also allude to it, even a case like Rwanda, where we have 100% universal healthcare coverage. Then comes the question around quality of healthcare, affordability of healthcare, which also is addressed differently, but at least even when they can afford the basic healthcare insurance, it's already a stepping stone in the right direction. Now, to your point, what has been done, and I did, it's a good segue into some of the reflections that I just shared. Again, our starting point was, can we ensure that every household has a minimum access to some form of healthcare? The government of Rwanda launched a partnership with Babylon Health, which was really, again, the intention was, how do we use digital technologies to make healthcare services more accessible to people? And when you talk about more accessible, you're also understanding that you don't want people to make lengthy trips to the nearest health facility. They're already weak, because by the time you're going to a healthcare facility, you're already not feeling well. So if you have to make even the trip, I think it also worsens your condition. So these are the benefits of really using digital technologies, because you make it more available. And the other thing that we've done well for Rwanda is the network of community health workers. And why that is important is that even for those that are still not able to access healthcare facilities within their proximity, then you have someone who will go to them. And that becomes part of the, the whole of a systemed approach of how do you make healthcare services, possible. But even when I say that with we also need to be humble about what we've already been able to achieve, because the journey is still long in terms of what needs to be done now in aspects of affordability, aspects of quality healthcare. And why is this important? When you look at the ratio of doctors to population, there's still a huge gap. So it already means they are already overwhelmed. I think during this, maybe it was the day before yesterday, when you heard from Odas, who was talking about the AI, for radiology solution, and the statistic that is there is a stark reality that you'll find in most developing countries, where for Rwanda we have about 13 radiologists, which means you have, for every one radiologist, you have 1 million people. So how, in the event that you can imagine the volume of imagery they have to deal with, without access to digital solutions that make it easy for them to be able to sieve through all that volume and figure out what is the most critical one to follow up on, because criticality in this case is only going to be based on who is in a critical condition, versus could there be someone in this whole pipeline or backlog that I have, that if I take care of them right now, I prevent a crisis in the future. And this is really where I feel, even as a country, we're trying to put in more effort to say, in the absence of having enough healthcare practitioners, how do we then use digital technologies to support their intervention, so that at least we're able to deliver that quality healthcare to our citizens? Telemedicine has been, one of the solutions that has been long in use here in Rwanda in our hospitals, where we're able to link all the healthcare workers in the healthcare facilities across the country with some of the main hospitals that are mostly in the city, but also in some of the secondary cities. What that also allows is for the knowledge transfer, the skills transfer to happen across the system. I think Dr. Mpunga, when he was here, he may have also mentioned the effort that is also being made around skilling our healthcare practitioners, creating dedicated programs where we have both the quality but also the quantity of healthcare practitioners that can help us. And I'll end on this note. Again, The ambitions are high, the journey is very long, and this is where we know we cannot do it on our own. This is why we're very passionate about bringing on board startups, because there is a contribution that they can make in really closing the gaps around healthcare, but also using digital technologies to support healthcare. I wanted to say one last thing, and I think we talked about co-creation. If we want to talk about scale, it also means even amongst the teams in the startups that are creating solutions, you need to have diversity. Diversity in terms of, you want a solution that is working in Rwanda to also work in Cameroon. How do you understand context better so that when you scale to another part of the continent, you know that it will be a right fit for what you're looking for? But you also want diversity from a gender perspective. I always use the example, and I think we all know it when we talk about the seatbelt or AC. Thankfully, we don't have AC here. It's very hot. But the example that is provided around seatbelts and AC is that largely, when you look at how the seatbelt was designed, it was designed mostly for male. Yeah. And actually, when accidents happen, it's true. Look at the statistics. When accidents happen, the people that get the most damage are female, because of the way it's been designed. It hasn't taken into consideration the different contexts. Now, I like to talk about AI because AI has its own biases. So if you don't have that diversity in the team to ensure that those biases do not come out from the way the solutions are designed, then the divide that we're talking about, the lack of context, is always going to be there, and that will also prevent the scalability that we're all looking for.
Thank you so much, Minister Paula, for what you have actually shared with us. I'm going to ask one last question to Dr. Anne, but I'd like to inform the audience that right after this, we'll have a Q&A session. We'll take about 2 or 3 questions. We'll limit it to 3 maximum. So prepare your questions and get ready. I'll be coming to you shortly. Dr. Anne, Minister Paula has ended on the note of artificial intelligence. And in what way does the new report build on the previous AI in Health Maturity Report? What will help increase the level of trust in embracing virtual health delivery?
Thank you, Fiona, and I want to thank Minister Paula because I am completely aligned with what you said, and definitely the gender balance is, first of all, very important in our innovators here in the hub as well. We looked specifically for teams that have a gender balance, so definitely worth it. But also the fact that technical solutions can really remediate a shortage of health workers. This is so important because we will never be able to train enough health workers fast enough. If you have 15 radiologists or 13, I don't remember, Minister Paula. I know Kenya, for example, has 6 oncologists. Ghana has 30% of their whole population has high blood pressure, the main risk factor for cardiovascular events, for heart attacks, and they have one cath lab where you can address this, where you can bring a stent in your coronary arteries and prevent that you do a heart attack. So there's a very big lack of specialists in many, many countries. And if you can centralize these experts and make sure they guide other providers through their patient care, you can solve a lot of the problems. But also AI, to come to the point of AI, I am passionate about the power of data and what artificial intelligence can do in health, because it can not only strengthen human intelligence, it can also make their work easier, faster, more accurate. We have so many examples of how radiologists now make better, faster diagnosis thanks to the AI tools. During COVID, it was a massively important tool to use for lung disease, to detect the lung disease due to COVID. And I think it really is going to be the future. If we understand better the problems we are trying to face, and if you only look at health equity problems, for example, you need to understand what are these underlying drivers. And only the vast amount of data, the computational power, machine learning, artificial intelligence we have now can really help us understand that. And that is the main power for me of artificial intelligence, that we will generate these insights. Is it the health system, or is it the place where the person lives, is born, like Carlos was saying? If you live in one zip code of New York City, you have 25% higher risk of experiencing a stroke than if you live in the neighboring zip code in New York City. So currently we are analyzing that also with the city of New York currently, specifically, what drives this. It's not only the health system, because it's similar, the health system people are seen. It is the underlying factors that are so important. And that brings me to the main power of this report. Why do we call it virtual health and care? Because the health part, what you were mentioning, Minister Paula, the prevention part, is the biggest opportunity we have. We have to transform our health systems from these the care-focused systems that they currently are. We have to transform them to become real health systems that keep people healthy. And it is possible. If you really detect risk factors early, you make sure that a person with a high blood pressure never does a stroke or a heart attack, or with other risk factors. So this is key, and the technology there for us is really the main player that we have in our hands. So lastly, this report is exactly building on the AI in Health Maturity Roadmap, which was also centered around human-centered design. Governance and regulatory systems have to be agile to make sure they get ready to apply AI solutions in their health. Partners have to come together from different sectors, all the same pillars as in this maturity roadmap for virtual health and care. So definitely it builds upon the previous work.
Thank you so much, Dr. Anne. I'd like to open the floor. Okay, I can see one hand. I'll try and limit to only 3 questions, and I have already found the 3 people. Keep your question brief, and do indicate who you're directing it towards.
Yeah, thank you. My name is Alex, and my focus is in tech. So I have a simple story. Okay, yes. Okay. Let me put it this way, maybe better. It's basically innovation and then policy. So oftentimes, innovation moves a little bit faster than policy. What maybe ways are you looking at innovating around policy making? And that, I mean, building, let's say, frameworks or sandboxes to ensure people can easily test their solutions. But also focusing a little bit more on the people in the different organizations. I know you mentioned the demand and the supply side, but how about the people in between? So it could be, let's say, people working in organizations like Ministry of Health or different institutions. So sometimes they may not necessarily have the right technological knowledge to actually understand that given solutions are going to make a difference. And instead they look at them as though they're going to be more or less like competition. So how best can we improve less on capacity building within the different institutions, or rather innovate the model to ensure they can easily adapt the new solutions being shared? The head of Novartis, because in 2020, sorry, in 2020, let me give an example. In 2020, we're working on a solution where we're detecting COVID-19 by analyzing coughs through a smartphone. And when we're reaching out to different hospitals, let's say in South America or to Asia or to hospitals in South Africa, oftentimes we find that the people you approach in a given hospital wouldn't necessarily open up, not because they don't appreciate the solution, but rather they don't appreciate or they don't even know the technical know-how of how it's going to work and benefit them. Thank you. My name is Alex Kalanda.
Thank you for the nice question. It's a difficult one, and I am the head of the Novartis Foundation, and just to specify. So the question is how to innovate policy. Well, that's the reason why we made this report. We want to make policymakers aware that it is not everywhere so easy to scale the virtual health services rapidly. You have to choose to invest in these domains that need most attention in your country. So it will help policymakers detect, is it in my people I have to invest, that people get better digital skills, or is it in my data strategy, my data governance structures that I have to invest? So this is the goal of the whole report, to innovate policymaking for virtual health and care. However, I think it is not only in the hands of the decision makers, the health providers, the payers, everybody, and the people have to align that this is the way forward and have to accept it, have to request it. Because if you if you want it to be scaled, it has to be taken up like mobile financing now, for example. It has to be felt as a need for the people who live in a certain country. So it is not only the policy making that will solve the problem, the whole of society has to be involved as well.
Thank you. My name is Jackie. I work for IntraHealth Rwanda, and my work is around digital health. Yeah. So it's not a question, just a reflection, and I do appreciate the report. Thank you very much, because it's going to guide us through this journey. I think everyone was relating. Yeah. So the first comment is about demand creation. It's true, digital health can be scary for especially providers, senior doctors. They are so, I wouldn't say resistant, but it's quite new. So I would suggest that, I think it's in line with my colleague who asked that question, to make sure that we design certain messages, a certain way of actually bring them on board so that we need them in this journey, because they have seen a lot, and I'm sure they are great contributors. The other thing is data and technology. We've seen very good innovations come and go. So maybe we should encourage to document what works, what doesn't work, so that whenever whoever wants to innovate can actually don't have to reinvent the wheel, and make sure that actually goes to what is working, and actually what did not work, can I see where did not work and actually take it up from there. The other one is on PPP. I think that is what we need. I think Minister Bora mentioned about community health workers. We value them so much here in Rwanda, and that's where the prevention actually takes place, because they reach our patients very early, and they can prevent severity of the disease. So I would suggest that every country who actually very want to go into this digital health can have some local companies that produce local made phones. We're so happy that in Rwanda we have Marathon, but they're still expensive. For example, we do have more than 60,000 community health workers. So you can imagine, if we are looking at sustainability and we have to rely on government, you can do the math and see that cost. So maybe in business model, you can see it's a long-term kind of business, and be flexible enough to actually support the government, because it's good that we do have, we can think about connection, but there are certain applications that can actually go offline. But of course we need, you know, connection, but we need a device to have that enabling environment.
Thank you. Last question. I had seen a hand. Oh, okay.
Yeah, thank you so much to the panelists for very informative perspectives. My name is Tom Oluoch. I'm with CDC here in Rwanda. So I had two questions. The first one is to Mr. Boka. I think he talked about something about unlocking access to capital. Because as we know, I mean, there still exists a lot of gaps. You talked about the last mile, and I think one of the presenters talked about 46% of the global population is not connected to the internet, which is an exclusion factor already. So thinking about investments, and I know this is an inclusion of, I mean, includes foreign investments, domestic investments by host country governments, and the private sector, like you mentioned. So my question is, just what's your perspective on how we lead and spur this thought around investments and demonstrating the value of investment in digital technologies for improved economic gains or even the better health outcomes? And then my second real quick one, I was really happy to see that Transform Health is one of the partners in this initiative, because I know they've been pushing a lot on health data governance, which includes issues around privacy, which we talked about, especially as we move towards individual patient level data moving across systems and as across countries. So it's really good to see them as one of the partners. So again, I'm just thinking about, if we think about cross-border, we're thinking about national level data sharing, but even cross-border data sharing. So how do we spur continental leadership, especially the political leadership? And this perhaps I may address to the Honorable Minister about the political leadership through Africa Union, WHO Afro, Brian, and others. I mean, how do we ensure that they're playing the right role to ensure that Africa can, get the regulatory, licensing, and other factors lined up properly to benefit from these digital solutions? Thank you.
Why do you want us to close this meeting with very difficult questions? They are extremely valid. And this is a long discussion on my part on the financing. I'll try to make it short before handing to Minister Pola. I'll give you the context. When we talk about 46% of the world population not connected, it's more or less 3.6 billion people not connected. There is a report called Connecting Humanity, and the required amount for connecting humanity is $428 billion between now and 2030. Out of this $428 billion for Africa, Moonshot 2019, made by the World Bank, is $109 billion. Now, on purpose, I use the term unlocking access to capital. Now, in terms of instrument, we have investing, which calls for different stakeholders. We have financing, different stakeholder. We have funding, third type of stakeholder. The mechanisms are not the same. They are driven by the level of yield, profitability. They are driven by the objective and KPIs of the government, because sometimes government is funding. So investment is from the private sector, either from the shareholder or from the capital market. That's why I'm saying it's a long discussion. However, we have produced a report which is free of cost, free of charge, available on our website called 21st Century Financing and Funding Model. Lassina is referring to 211 pages, but there is an executive summary of 12 pages. Okay. So, all to say, as I was mentioning, and it was not a joke, everything is there. But we need to get away from our laziness and to read the document. It's a very rich document explaining 4 ways of providing the solution. The first recommendation that we have made is to broaden the base of contributors for investment, meaning that we have other type of investors that could help us fix the problem of unlocking access to capital. That's number 1. Number 2, we have the Universal Service Fund, which is an amount collected by institution put in place by the government. What we said is to fix this problem, a part of this taxes should be recycled back into the same sector, which is ICT. Number 3 is the creation of an international fund. And that is a very important problem. This problem is, if you take some countries, Syria, which is under war, you take Yemen, no investor is going to go and invest into very risky countries. Now, if we mitigate the risk by an international institution, existing one or a new one, with capital that does not require a high return of investment, and on a longer term, we may help these people being connected. I don't remember the 4th recommendation. You will get it from the report if you take the time to read it. I hope it answers your question. I'm going to give back to Fola.
Thank you. I think the question you ask is very timely, and it's already in the works. And what I also want to say is perhaps we also don't need to reinvent the wheel, because there are already 2 streams that are running in parallel. One is with the CFTA agenda, cross-border data flows is one area that is being looked into to see how that can unlock trading across borders. So the same frameworks we would use for that would in many ways also apply, because you don't want to have different siloed frameworks on cross-border sharing, one that is specific to financial data, another one that's specific to health data, another one. And so I think having a holistic cross-border sharing framework is very important. Actually, the Center for Fourth Industrial Revolution here in Rwanda is also championing that, even starting with the East African region, to sort of do like a proof of concept, and that can then be expanded to other parts of the continent. Smart Africa also has embarked on a similar initiative, which is really also focused, and they've brought on board the African Union, UNECA, and many other partners who also want to see what it's going to take to really have harmonization of many of these policies and regulations. I did talk about the personal data and privacy law. Many countries on the continent have either have already enacted one or are in the process of putting together one. But I think what's important is that these in many ways are aligned, because the absence of that will then start to have gaps in how data will flow across the various borders. I also wanted to quickly share my thinking around, and I think it's also one of the pillars in the report, which is really the need for reskilling and upskilling. And when we talk about this, we're not just talking about tech, people. We're talking about non-tech professionals that need to start to embrace some of these things. Now, I want to share with you an example, and this is really something that I always hear when us technical people are talking to people. It's like we're speaking gibberish, like no one understands. So you have a great solution, but no one understands what you're trying to solve because you're using heavy technical terms. And I think that's where there's always a disconnect between the users and the people that we want to win over. And I think even, and this is really my advice, I also struggle with it as a policymaker. Like sometimes I'm like, do I really need to say interoperability, or do I find a way of saying it in a very, for someone to understand what I'm saying? Can these systems share data? I think DG Lassina talked about, can't remember the term that he was using around data, even, where you use the same data. It's a technical jargon. The only one principle. There you go. And sometimes we'll say it's ask once policy. Now, when you say ask once policy, one will be like, what does that mean? You're like, okay, if I'm going to ask you about your name, your date of birth, and everything, I should ask you once, especially if you're looking for it for a passport, and when you want to get a birth certificate, why should I give you the same information? So I think it's also a challenge to us in the tech, industry, to find ways of breaking down things in a way that people can understand, because we have the solutions, but I think the disconnect is how people can relate with what we are saying. And so people are not just waking up and deciding, I don't want to use this solution. They just are finding a hard time understanding what exactly we want to put out to them. So, and this is always going to be work in progress for all of us to figure out how do you communicate that value proposition, but at the same time, it will go hand in hand with skilling them and upskilling them. In Rwanda, we decided to create chief digital officers within each of our sectors, because we could already see there was a disconnect between the digital solutions we are trying to provide and the policymakers and the challenges they want to provide. So we said, let's create a role that is able to understand if agriculture is trying to solve for productivity in the agriculture sector, can we have someone who becomes the interface between the industry and the techies and find a way of creating that kind of working relationship. And lastly, I think for me, all of these things are work in progress. I sense frustration when we're trying to develop solutions. We want people to get it overnight. I see Siobhan in the room. I'm sure she would share a lot of lessons learned on how they were able, the journey they went through with Babylon. It's never easy in the beginning, but I think once you have people who get it and understand what the value that you're creating for them, then somehow things start to evolve. And so it's that patience that we need. The same way we need patient capital to scale solutions, it's also the patience to be able to say, how do we walk this journey? You'll not find the converted already, but I think our job is to preach until someone fully understands the message and what it means for them.
Thank you so much, Minister Paula. I think we have come to the end of this particular panel discussion. So sad, amazing insights that are being shared here. But I'd like to thank our panelists for their amazing discussions. Thank you so much. If you could kindly give them a warm round of applause. And you can actually come and take your seats. On the panel, we had Mr. Lassina Kone, the CEO of Smart Africa. We also had Honorable Minister Paula Ingabire, Rwanda's Minister of ICT Innovation. We had Dr. Anne Ertz, the head for Novartis Foundation. We had Mr. Boker Ba, CEO, Samena Telecommunications Council. And lastly, we had Dr. Brian Chirombo, representative of the World Health Organization here in Rwanda. And I'd like to call Mr. Hani Eskander, Senior Coordinator, Digital Services at the International Telecommunications Union, to come and deliver the closing remarks for today.
Okay, thank you very much, and hello everyone. Actually, I've been giving a very difficult task, is try to kind of summarize like almost 2 hours of amazing discussion. So forgive me if I will not be able, of course, to give due justice to all the great insights. But first of all, on behalf of the International Telecommunication Union, ITU, which is, by the way, one of the co-chairs of the Broadband Commission, would like really to thank the working group and the co-chairs of the working group, Novartis Foundation and WHO, for this amazing, not only report, but a series of reports. So I will echo what Bokar said, read the report, please, because it has a lot of things. So that's my first call for action, is to read the report, but also to try to kind of digest it. And so one of the key things that came out of this amazing discussion is that you are very lucky, because this is exactly the right time to innovate for health. I think you would all agree that because of COVID and many other things, the next 3 to 5 years, there is a huge opportunities for innovating for health. So absolutely, you are in the right place and at the right time. However, the health ecosystem is a little bit complex, and that's why we need such kind of guidance to kind of understand how to kind of balance between all the different things. Particularly if we are to think how we insert this innovation into the public health system. There are a lot of things to be thought of, and I think the report will try to identify all those 6 policy areas that needs to be addressed. One of the most important things that came is really on the governance, that we need governments, particularly on the health sector, who are willing to take initiatives, and even in some cases willing to take some risks. I think Mr. Paula said something very interesting, is that they were doing the innovation and in parallel doing the regulation. Not many countries are able to do that, but I think that's much better. But I think it's definitely one of the characteristics and the call for action for governments to really be more agile, more initiative taking, but also more young. I mean, we've been noticing the CEOs of the most advanced digital countries are in their 30s. So I think that's another call for action, and I think the Rwanda government is a very good example of having this young leaders who are really willing to push innovations. Another thing is this kind of leadership is needed to have clarity and a plan on how you integrate innovation into the public sector and public health systems. And in that, I think there is a huge need to understand that the health sector on its own is not capable of doing and to scale, because many of the investments that needed are simply not in the mandate of the health sector. And that's why I think, again, the example from Rwanda is amazing, because there are so many things that are probably more on the mandate and also in the area of skills of the health in the IT side of the story. I mean, there has been a lot of mention of connectivity, devices, how you bring the cost down, how you ensure sustainability, all the regulatory issues, some of the regulatory, the privacy and data protection laws, etc. It's not the health sector who will build them. However, There is another thing that is, I think, also came in the discussion. What is really the role of the health sector vis-a-vis this whole digital health ecosystem? I think that's a very interesting point. Are we expecting the ministries of health to develop applications and to innovate, etc.? I think probably this will not happen. However, the health sector and the IT sector, the public sector, they have a lot to set the scene. We have mentioned few things, but in the health particularly, there are things that we have seen in many countries where there are some infrastructures that needs to be there. Like, for example, registries. If you have registries, like health professional registries, patient registries, health facility registries that are managed and maintained by the government, you as innovator can come and plug on top of this infrastructure innovation that can leverage this type of infrastructure. So this is another example of the role of the government when it comes to enabling, creating an enabling environment for the health. So this type of role identification between the public and private and the health and IT, I think this is one of the key kind of calls for action when it comes to, and the recommendations that are coming out of the report. Another thing I think it came is also driving and developing areas, and I think Minister Paula, I think it was striking to make this kind of statistics is to showcase that 95% of the investment are made for not on the prevention. This reminds me of anecdote that one of the senior health officials in one of the large countries, he was joking and say, my health ministry should be called Ministries of Sickness, not Ministry of Health, because we only intervene when people are sick. So, and he was very kind of against that, of course. So this is another call for action. Create meaningful innovations. Create innovations where there is a need and gap and potential impact. And another thing, I think we need also to learn from the other sectors. Recently, I mean, we at ITU, we are very much involved with a lot of countries, of course, and across sectors, so we see what happened in the other sectors. So recently, I've been personally engaged with one of the countries who are leaders in digital government in general, and the CIO told me something very interesting. He said that I was asking him about the change management, how you ask people and help people to adopt your services. He told me it's very easy. Start with a service that people really need it. And he gave me 2 indicators about that. A service that people will have to use it several times per week, or a service that without the digital they cannot do it. Like, for example, traveling 5 hours to go to the nearest hospital, etc. Start with that. And you know what? If you are delivering services that are very simple, like a WhatsApp simple type of services, you don't need to promote it, because you know what? People will tell, did you download the health app called blah, blah, blah? The word of mouth is much powerful. And this is how people now are very much used to use mobile and simple applications like social media, etc. So if your application is simple to use and really address a real need in the life of people, that you are sure that people will use it, because there is a huge problem with stickness. People usually don't download the app, use it for 2 weeks, and then left it out. So that's another call for action. I think it came a lot of time in terms of meaningful type of services. Another thing is about privacy. I think it was very much also highlighted. There are a lot of things that government needs to do. I think we mentioned, but also you as innovators really think making sure that everything is consent-based. Don't store data on the app unless it's very needed. Make sure that minimum level of data, the minimalistic principle, don't exchange data unless it's absolutely necessary, etc. So that's another thing. And privacy, by example, I think it was also mentioned. Interoperability, I think that's another, again, call for recommendation. And I think the regional aspects, I think it was mentioned that you need to have not only within the country itself, but possibly also across different regions. So maybe a last one, because it's very difficult to summarize, but I think the business model, I think we need to finally move from the model of having donor-based type of financing, and I think this was the issue of digital health so far, but I think now we start to move to more commercial type of transaction. I think the example of Babylon in Rwanda is a very good one. I think there is a role for insurance, so this is another type of kind of call for action for insurers and the public to kind of reimagine and create new business models for digital health. There are probably a lot of other things, but I'll stop here and really I invite you again to read the report, the great report, and thanks again for the working group. Thank you.
Thank you so much, Mr. Hani, for delivering the closing remarks. We have come to the end of today's launch. It is sad, yes, I know. Would have loved to continue having more conversations around these, but we do appreciate each and every one of you who was present. We also do acknowledge our online presence, our online viewers, or rather, who have been with us from the beginning. Now, to just reiterate, the report that was launched today, The Future of Virtual Health and Care, Driving Access and Equity Through Inclusive Policies, was developed by the Broadband Commission for Sustainable Development Working Group on Virtual Health and Care. The working group is co-chaired by the World Health Organization and the Novartis Foundation, and the report was developed in support from Accenture. So we'd like to thank each and every person who was part of this report and for sharing it with us here today. Ladies and gentlemen, right after this, we'll have a reception. So feel free, walk up to any of the speakers that we had today if you have any more pending questions, and network and have fun. Thank you so much.